Hi, I'm Lee Schilling. I'm an OBGYN physician, and I want to bring some discussions about contraception to YouTube. And this first one is one of five that I'll be doing, and this one's on family planning. Well, this is a picture of a sperm fertilizing an egg. And in order to get pregnant, you need a sperm and you need an egg. Well, how do you get those? Well, this tells you all about that, and this goes into things like puberty. And I think if you have a printer watching this, it's much simpler to basically make a copy of the print and just read it when it's on the screen for a longer time. At any rate, development at puberty begins in the brain, and there's an area in the brain that starts releasing some hormones that cause what are called the genitals, or the gonads rather, um, the ovary and the testicle, and it causes them to start maturing. And that begins about age 8, but probably takes a couple of years to get to the end. And it may be sooner for females than for males. But if you're thinking about contraception, ask yourself these questions. When do you want to start a family? How old do you have to be to get pregnant? What can you do if the condom breaks? What's the best contraceptive? Are contraceptives safe? Is pregnancy safe? Which is easier to hide, a contraceptive or a pregnancy? Well, what are the methods? Let's see. Hope and abstinence aren't contraceptives. They're not methods, they're behaviors. So when do you plan to get pregnant? How do you plan to avoid pregnancy until then? And what are you going to do if you get pregnant before? Well, I don't think it's just you, the one who can get pregnant, who needs to be concerned. I think it should be a couple thing to decide what to do about being sexually active and not having a pregnancy until you want one. And it is what it is in terms of ideal contraceptives. The ideal one has not yet, which is one that is safe, simple, easily reversible, and without side effects, and just independent of when you're having sex. So few procedures offer more relief from anxiety and have a higher success rate than tubal ligations. Well, if you haven't had completed your family, you're not ready for that, so you're going to have to do something beforehand. And if you have had all the family you want, then this is something you might want to give some thought to. The failure rates are 1 in 200 versus 1 in 1,000, depending on what type of operation was performed. And if there's any question about any future change of your mind, you might want to consider an implant or an IUD to buy more time. So my goals would be to inform you about family planning, to assist in helping develop a perspective to improve problems, define some of the problems, and review where you can get even more information at the end. So I solicit questions anytime as we go. Just email me one. May take a day or two to answer, but I'll eventually answer it as quickly as I can. The email address is just underneath the email questions. Well, individuals have to decide what's best for them. That's not the teacher's job. And I think it is one that works better if the couples decide rather than just one person. And that job's to educate and answer questions, correct information and myths so that people are well informed. That's the job of the educator. The individuals have to decide what's best for them. So, have you ever used a contraceptive before? Do you have a favorite? How important is it to avoid pregnancy? Are you trying to avoid or delay pregnancy? When do you plan a pregnancy? What questions do you have? Well, most American families want 2 children, and to achieve this, the average woman spends about 5 years pregnant, postpartum, or trying to become pregnant, and 30 years, more than 3/4 of her reproductive lifetime, trying to avoid an unintended pregnancy. Well, an unintended pregnancy is one that was either mistimed or unwanted. That's 45% of all pregnancies. And 31% are if you didn't want to become pregnant at the time pregnancy occurred, but wanted to become pregnant at some point in the future. And that's a pregnancy regarded as mistimed. And if you didn't want to become pregnant then or at any time in the future, then the pregnancy is considered unwanted, and that's 20% of pregnancies each year. So if Roe v. Wade, that's a Supreme Court decision saying it's up to the states to decide what's legal, but they say it's legal to have an abortion. If that's overturned, then it's going to be very important that all people be well informed about preventing unintended pregnancy. Well, the reality is that some things just work better than others. Infertility is not something you can know by just looking at somebody. If you're a teenager, the percentage of teenagers not able to get pregnant is 4%. If you're 40 to 44, that if you're 40 to 44, that increases to 30%. And infertility applies to both males and females. Well, what you can see here is that Romeo was fertile, and Juliet also was fertile. Well, what are some obstacles to getting contraceptives? Well, one is most places don't give them away free, although Planned Parenthood is one. But if if you don't have much in the way of resources to purchase what you need, you're much more likely. That's the top one. where it says poorest, they have like 130 unintended pregnancies versus 22 for the least poor. So poverty is the main cause of misfortune and even disease. The non-compliant patient may not be able to comply. Maybe there's a sick child or relative at home that they have to stay with. Maybe they're sick themselves and have no money. Maybe they have no way to get there if it's not close enough to walk to because they don't have any working transportation. And they can't call maybe because they don't have a working phone. Maybe they misunderstood when they were supposed to come back. And maybe they are not able to exercise choice because they've got an abusive partner that won't let them out of the house. So these people need help rather than blame. Well, by the time females in the U.S. reach 45 years of age, they will have had 1.4 unintended pregnancies, and 43% will have terminated a pregnancy. Well, how do you get 1.4 pregnant women? By taking a large group, say maybe 100 or more, and ask any of them if they've had an unintended pregnancy, and then that number is divided into the 100 or whatever the largest number is, and that way you don't always get a 1, 2, 3, 4, or 5. You might get a 1.4, and 43% will have terminated the pregnancy that was unintended. About half the pregnancies, 45%, each year in the U.S. are unintended despite very effective contraceptives. So if you ever go to Niagara Falls, be sure that you don't miss getting up into Canada. So take your passport or whatever you need to be able to go over there, because they also have a Niagara Falls, and it's an interesting place just to explore. Well, thanks for your attention. That ends this. And the next thing we'll be talking about are birth control pills on the next session.